Hello, good morning. I'm Professor Naresh Rakha, doctorate in immunology from University of Liverpool, England, and presently working as Senior Scientific Officer at Indian Institute of Technology, Ropar. It's my moral duty to make the fellow citizens aware about the dangers, the protective measures, and clear some of the misinformation which is going across the populations, across the countries. COVID-19 has made its presence felt in almost 50 countries and several cities in India too. If you are living, working, or traveling in places where novel coronavirus is present or has been reported, you are naturally going to be worried about it. What to do? Don't panic. Just be natural. Just be informed that there are several protective methods by which you can protect yourself and do the normal activities of the day. You should know the 6 things which are really very important. Number one, the COVID-19 spreads through the direct contact with the respiratory droplets from an infected person. If you are within 3 feet area of infected person who releases COVID-19 viruses through either sneezing or coughing, it is very likely that COVID-19 virus particles will get into your body. Therefore, you should make sure that you maintain a minimum distance of 3 feet from a person suspected or who is having problem of coughing or sneezing. Secondly, the COVID-19 virus particles can spread through the contaminated surface. For example, if someone sneezes and doesn't clean the hand and uses surfaces like doorknobs, door handles, and then normal person comes and touches those surfaces, the virus can get into the hands of that person. And if that person uses his hand to clear the nose or touches the face, eyes, or nose, the virus will get entry into the body. They are showing you the example. So whenever you touch a surface used by other people in the crowd, in the marketplace, in the offices or big buildings or mall, then you should immediately wash your hands or at least keep some alcohol-based hand rubs in your pocket, in your bag, and sterilize your hands as soon as possible and as thoroughly as possible. If soap and water are not available for washing, alcohol-based hand rubs are really wonderful. Third important tip for you to know is that symptoms of common cold are different from the COVID-19. The common symptoms of COVID-19 are fever, cough, and shortness of breath. In severe cases, COVID infection can lead to pneumonia and difficulties in breathing. Deaths are amongst the older people who have other sicknesses or problems with their immune system or with their metabolism. During the winter and early spring season, many people develop allergic rhinitis or common cold. In those cases, a running nose is the first symptom. But in COVID-19, running nose is not one of the symptoms. It's immediately coughing, fever, and difficulty in breathing. The fourth point to take care of is washing your hands. It's really very important whenever your hands are visibly dirty or whenever you have touched the surfaces out of your home, maybe an escalator, maybe a door or a bathroom handle or something, you must wash your hands thoroughly. The most effective way to protect ourselves from coronavirus is washing the hands frequently and thoroughly. So I'm going to demonstrate how we should wash our hands. So I have with me soap of Centur, Dove, Vivel, organic soap and some hand washes including Dettol. It's not important which soap I'm going to use. Important is how thoroughly I'm going to use the soap and running water to clean my hands. Since nowadays you might be required to wash your hands 8 to 10 times, so it's very likely that hand skin will get dry. So prevent our skin from dryness, we can use any moisturizing cream after washing and drying our hands properly. Since now we know that the COVID virus travels from our hands to mouth. So avoid touching your mouth, nose, or eyes with hands. Make it a habit that your hands are down only. You should fold your hands and not to shake hand with others, at least those who are having fever or coughing and sneezing type of symptoms. You should cover your nose and mouth when you are sneezing so that you are not transmitting the virus through the droplets. You should use your elbow to sneeze like or use tissue paper, clean the mouth and nose and throw it in the dustbin, which should be closed and should be properly disposed of. You should know that there is no specific medicine, and whatever treatment is being suggested on the internet by several agencies and several people is incorrect. World Health Organization has clearly said there is no specific treatment, only clinical or supportive therapy should be given. If you have some fever, coughing and sneezing, please see the doctor. There is no taboo that if I am diagnosed with this problem, what others will feel. Your life is important for you. You must visit a medical doctor who specializes in handling such cases or take the help of the government agencies. Even if you need to be isolated, quarantined for some time, please bear that and don't try to hide the problem. If you like such type of informative videos, do subscribe to my channel Dr. Rakha. Give your feedback in the comments and share with others. Thank you so much.